Hibiwash is an antimicrobial cleanser that contains 4% chlorhexidine gluconate. Chlorhexidine gluconate has been used in hospitals for many decades. Hibiwash contains chlorhexidine gluconate, which kills microorganisms. It also contains soap, which cleans the body and removes the microorganisms and emollients which moisturize the skin. This protects the skin's integrity and helps prevent surgical site infections that can occur during or after the operation. Hibiwash provides immediate and long-lasting protection. First, remove all makeup, nail polish, jewelry and piercings. Cut your fingernails and toenails short and remove any false nails. Wash twice with enough Hibiwash, first to cover the body, then to cover both body and hair. Wet your face and body and turn off the tap to save water and to not get the Hibiwash diluted. Apply undiluted Hibiwash directly to your skin. Start from the top and work your way down. First, wash your face, paying special attention to the area around your nose. Microorganisms tend to get lodged there. Avoid contact with the eyes, ears and mouth. Wash your torso and back. Be especially careful around the armpits, navel, groin and genitals, and avoid the body's orifices. Hibiwash is intended for external use only. Proceed by washing your legs and don't forget the areas between the toes and the soles of the feet. Then turn the tap back on and rinse thoroughly. As the chlorhexidine has bound to the skin, the product will remain active even after it has been rinsed off. Hibiwash is gentle on the skin. It is not deactivated by blood or any other bodily fluids. Now, repeat all the steps above, but start with your hair. Rinse thoroughly and dry with a clean towel, paying special attention to the skin folds and the areas between the fingers and between the toes. Put on clean clothes. Do not use any creams, powders, oils, hair products, deodorants, perfumes, makeup or nail polish. Do not wear any jewelry or piercings either. You are now ready for your surgical procedure. Always read the package insert leaflet carefully before using Hibiwash. Hibiwash is a medicine with 4% chlorhexidine gluconate. Avoid long-term use without medical advice. Consult your physician, nurse or pharmacist and always follow the hospital's protocol.